All right. Good afternoon, everyone. And get started. This is Ian Mackey with the School-Based Health Alliance. I'm joined by my colleague Ufoma, who's going to be assisting. Thank you, everyone, for coming to our third ECHO session. I anticipate we're going to have a little bit of a smaller group today just because we're in the middle of the summer and school is out and people are on vacation. We are actually, unfortunately, are missing a lot of our faculty today as well, but I have sent them our case presentations in advance, and they have already sent me some great feedback, which I'm going to share. So we're going to go ahead and get started. I can just advance my slides. Oh, okay. Hold on. Okay, so as I mentioned earlier, please put your name in the chat box so we can record you for attendance. I did want to mention that unfortunately one of our faculty, Craig Van Kempen from Adolescent Health Initiative, he's moved on from AHI, so unfortunately will not be doing our presentation this afternoon. But we are very pleased that his colleague, Ellen Wagner, will be presenting and taking over his role as expert faculty. She'll be presenting with her colleague, Jenny Lane, also from AHI. And if you remember last month, the session was focused on creating affirming and welcoming environments in your school-based health center. And for this month, we're going to be taking that school-wide. So we're looking forward to hearing from them. We're also going to have two case presentations, one from Nicole Davis and Brenda Ortiz from the Cardozo SBHC here in Washington, D.C. And then we're going to hear from Jennifer Miller Algier from Ruth Ellis Health and Wellness Center in Highland Park, Michigan. So I just want to remind folks a little bit about CEs. So in order to receive credit for these types of sessions that are two parts, so the session this afternoon and last month's session are parts 1 and 2 of the same topic area. So you'll get CE credit for the topic area, not each individual session. And we have a few topic areas that are like that. So for those sessions, you must attend at least one of those live sessions within that same topic area in order to receive CE credit. So if you have to miss one live session, so if you missed last month's or you're missing this month's, you can go on Moodle, you can watch the recording and post a reflection, and you can still get credit. And we will have the slides and the recording posted to Moodle by tomorrow. And the email that you will receive from APHA will come from the email that's listed on the slide. I think that was a little confusing the first time. People weren't sure who the email was coming from. And so keep a lookout for that email. And that probably won't happen for another week and a half. So we just talked about this. And if anyone has any questions or needs clarification, please don't hesitate to reach out to me. So you'll have until, so if you either are missing this live session, and so you're watching this recording later, or you missed last month's live session, you will have until next Tuesday, July 16th, to watch the recording and post a reflection on the forum in Moodle. And if you're not sure where that is on Moodle, please send me an email and I'll help you find that. Okay, so now I'm going to pass it off to Ellen and Jenny.
Hello. Give us just 1 second to pull up the slides.
Sure.
Great. Let me just pull up one more thing. Oh, there it is. Perfect. Great. I'll scoot over just a little bit so you can see my colleague. Hi, I'm Ellen Wagner. I'm the Assistant Director at the Adolescent Health Initiative.
And my name is Jenny Lane. I'm the Senior Program Manager. I'm going to be kind of sitting off to the side for most of this, but I'm going to chime in at a couple points.
So if you have a question for Jenny in the meantime, just know she's here, even though you can't see her, and she'll pop back on. So I was lucky enough to be able to sit in last week on the part 1 of this. So I feel really particularly glad to have been able to do that, as now I am picking up where Craig left off last time and talking about part 2 of this conversation, which is creating an affirming environment for LGBTQ plus students in your school. Oh, there we go. Okay, so the objectives for today are to understand the rationale for providing LGBTQ plus safe spaces, to learn practical steps to collaborating with your school to create a welcoming environment in your school, and to understand strategies for connecting LGBTQ plus youth to your health center. So I want to start by reviewing some statistics that reveal why it is so important for school-based health centers to work within the school they're in to improve the environment for LGBTQ plus youth. So the first thing I wanted to highlight here is the GLSEN National School Climate Survey. And this survey found some pretty staggering facts. So transgender and gender nonconforming youth are experiencing extremely hostile climates in schools. 4 in 10 of these students faced gender-related discrimination in schools. Here's some additional information from the 2019 Trevor Project National Survey on LGBTQ Youth Mental Health. And this was a cross-sectional national survey that covered over 34,000 respondents. So this is a very robust sample. And this national survey found also some pretty scary things. So 78% of transgender and non-binary youth reported being the subject of discrimination due to their gender identity, and 70% of LGBTQ youth reported discrimination due to their sexual orientation. And of those youth, 20% reported physical harm. And of those youth, 36% who experienced physical harm attempted suicide. More information from this survey, almost 40% of LGBTQ respondents seriously considered attempting suicide over the past 12 months. And this fact in the lower block here, 71% of respondents reported feeling sad or hopeless for at least 2 weeks in the past year. Just letting that sink in, that 71% of those 34,000 respondents felt down or depressed over at least 2 weeks in the past year is a pretty overwhelming statistic to think about. And then less than half of LGBTQ respondents were out to an adult at school. And that's kind of where we come into the pictures as adults that work in school, as we're thinking about what we can do or how we can address some of these facts. So somewhere between 40 and 43% of these students were out to a teacher or a guidance counselor. So depending on sexual orientation or gender identity, it was to other classmates, and then 29 or 30% for a doctor or a healthcare professional. So that, I think, is an area we can really hone in on and examine what we're doing and what we can be doing more to reach these students. So what can we as SBHC staff do? So one thing is make your SBHC a welcoming and affirming place for LGBTQ students. And another is to work within the school to make the school a more welcoming and affirming place, and work within the school to connect those young people to your SBHC. So last time we talked about that first bullet point about what you can do within the confines of your SBHC, and today we're going to zoom in and talk about these two other points, what you can do within your school to make it more welcoming and affirming, and then at the same time, what are you doing within your school to connecting those young people to your SBHC. A lot of the things that we're going to talk about today, I wanted to point out, are going to be strategies that are good for all students, but they're going to be particularly important when you're talking about this population, given all those things that we just talked about. So before we get started, I wanted to hear from you all, just kind of reviewing that chat. It's clear that a lot of you are already doing a lot of this work and have spent a lot of time investing in it and thinking about good strategies. So I wanted to hear from you all either by chatting in, or if you want to unmute yourself and share what are some things that you have that have worked in your school so far to make your school a more welcoming and affirming place. I realized my chat went away for a second, so I'm going to pull it back up.
I will say here at River Rouge, the kids themselves, the youth advisory organization, attempted to create a support group. It didn't completely get underway, but at least the effort was an attempt, and it was student driven. So I think there's a wide acceptance, or at least the beginning of, in this school.
Thanks. Yeah, I think working with the students themselves and the young people is always going to be a really key element to doing this work well. Other ideas? What has worked for you within your school to make your school welcoming and affirming? Again, you can chat in or unmute yourself and share that way. Okay. So what about some ways that have worked with your school, that you've worked with your school to connect young people to your SBHC, and particularly LGBTQ+ youth? Oops, sorry about that. Uh-oh. Let me just advance forward again to where I left off. There we are. Any particular strategies around what's worked particularly well here?
I know that if you treat somebody with genuineness and you give them good care, that typically that is your best method of referral. Like, I don't have a budget here, so, but everybody seems to come back in. So I think treating people fairly and correctly the first time, and I still make mistakes, you know, but I acknowledge them. And then it becomes more of a partnership too, you know, that we're both learning. So that's probably the only thing I can say has probably been my best connection. If anyone else has something, that would be great to hear.
Yeah, I think you make really good points, and that point about making mistakes and acknowledging it is so important, because we are, by doing this work, by the nature of the work, bound to do things, you know, that need to be acknowledged and apologized for, and kind of moved forward and learned from. So I think that's so important. All right. And what have been some challenges to making your school a more welcoming and affirming place? I heard, Maureen, you say budget. I think that is an important thing to acknowledge, that you're already working on tight budgets. You don't have a lot of extra money to spend on this. Any other challenges?
I have a comment for the previous thing. We were trying to figure out how to unmute it.
Oh.
And then I'm like, stop. I think for us, we don't have any type of GSA or anything in our school. And so I run our teen advisory council at both schools, and our TAC kind of becomes kind of morphs into like a GSA safe space type of thing because we welcome any and all students. There's no requirements to be a part of it. And so that kind of is a starting place for kids being welcomed and affirmed and being able to be who they are. I think challenges that we've come up with, not necessarily from the school staff, but just the culture in our community is extremely welcoming or affirming all the time or in certain circles. And so, you know, kids definitely feel safe to be themselves in our clinics and in our TAC and different places, but they don't feel safe to come out everywhere or be themselves everywhere. So a lot of our kids, like, I've been here a long time, so I have a lot of kids come back and visit me, or I'm friends with them on Facebook, and you'll see as they leave high school and go to college, then they're family themselves, and we get so excited when we're able to see them actually be able to be open in who they have always wanted to be and express themselves. So, but I think our biggest challenge isn't necessarily pushback from staff or anything like that, but more just our culture as a whole trying to adjust.
Yeah, well, it sounds like you've had some really positive indicators that the things that you're trying have been working. Thank you for sharing that.
One of the challenges that I have at my clinic is just time. All of our school-based clinics, we have 10 throughout Houston, and all of our school-based clinics serve different schools. My clinic in particular serves 8 schools, and so we have 5 major high schools. We have the night school population, we have an alternative school, we have a middle school, and some of our clinics serve up to 12 and 13 schools. And just being able to have the time to actually get into the schools, because we're in the clinic all the time, because the patients are constantly coming to the clinic. So just having that time to even be able to get out into the schools to even, you know, visit is hard.
Yes, you're very busy doing all of the other roles of your job, for sure. That is definitely a challenge. Any other challenges around connecting young people to your school-based health center? Maybe some of those things that you all mentioned already are kind of challenges in both arenas, I'm guessing. Just gonna check the chat. Oh, we do have a chat here. I'm just reading it. Yeah, looking at, there are challenges around reaching some of the most at-risk youth, which also includes looking into services in the community. Thank you. Okay. And then finally, before we jump into some strategies, what are some ways well-meaning adults could cause harm when approaching this work? Accidentally. Any thoughts on that?
Perceived judgments, and so they're not open and unwilling. You know, for instance, I just saw a child the other day who went into the ER most likely to be tested for HIV because he's a man who's having sex with men, and they did not do any of that testing. And I think it was because it wasn't an open forum. And he came in here and we did it all. We don't have results yet, but yeah. So I think they can be afraid to access the services they need.
Mm-hmm. Yeah. And perhaps the people in the emergency department were well-meaning, but they didn't have the knowledge base or the background or the understanding, you know, I'm guessing, but it's definitely an example of a time when we as adults can kind of miss the mark. Okay. So we're going to go over a whole bunch of strategies for the rest of the remaining time. We're going to talk about participating in school events and initiatives, providing active teacher and staff support, establishing and maintaining close relationships with school administrators, and having youth ambassadors to foster connections. And we're going to look at these domains specifically through the lens of engaging LGBTQ plus youth. I want to acknowledge that some of the things I will cover, you are undoubtedly already doing. And some of them are going to apply much more broadly, as I said before, to all students rather than to just specifically this population, and are just good general practices. I also want to acknowledge, as some of you mentioned, that you have a lot on your plates. We're going to go over a large variety of strategies, and by no means is the expectation that any one of you are going to do all of these things. My hope is just that we can think through some of these new things together and think about how you can get some ideas to try a couple new things, to strengthen some things you're already doing. And I'm also, want to hear from you throughout this, other things that I've not mentioned or thought of that you all who are doing the work on the daily basis may be able to share with each other. And then finally, I want to acknowledge that there are challenges that you're all going to have challenges side to side. I heard somebody said that there's no GSA at your school. You may have different infrastructures at your school and relationships with your school. They're going to either help you or be an obstacle to you to being able to do some of these things. So this first bucket, participating in school events and initiatives. We're going to walk through each of these points below and provide strategies for doing these things. Thinking about those two kind of main points, improving the experience of LGBTQ plus youth in your school and increasing their access to your health center. So immersing yourself in the school. So observe and learn your school's climate and culture. Every school is different, and the key here is to look for opportunities to be familiar with both teachers and students and staff, and to make sure everyone at the school knows you're an ally of LGBTQ plus students. You could consider wearing a rainbow pin and your pronouns in a visible place and make it clear that you're from the school-based health center. You could also be present during passing time so that school-based health center staff can get to know students and teachers. And since passing time is a common time for incidents to happen, SBHC staff can serve as informal hall monitors, a presence that's going to be appreciated by teachers, administration, and students alike. And this is especially important given those statistics we just reviewed about the treatment of LGBTQ plus youth in schools. Jenny's also going to offer a couple other ideas about ways you could immerse yourself in the school.
Thanks, Ellen. So I'm just going to lean right over here and share a couple that I've seen and been involved in. And I'm also aware that, hi, Amanda and other folks I know on this webinar who are doing some of this work and have some other ideas to share. So I hear you. I heard someone talking about the limited resources, the no budget, the how are you working within that. And so I know it can be really challenging. So some of these ideas require staff time and may not be feasible. But also sometimes a creative solution like working with student mentors who you have an established relationship with and maybe have been on your YAC for a couple of years. Can kind of do some of the leadership of these programs. So one is simply just examples of stuff that we've seen through RAS here, so Regional Alliance for Healthy Schools. At a middle school, one of the social workers did a DBT group. He found a grant to do DBT in theater. And so the youth who came to that group, it was a really nice, I think it was a therapeutic resource for them, but it was also somewhat of a protective factor to have a place where they could be a part of a group and create those relationships as well, strengthening the security that they felt. I know at a high school in Milan, Michigan, we organized, there was a health teacher who was very dedicated, and we had a peer education group that when I worked at Planned Parenthood, I was able to partner with the school and come out after school and do an after school program where they would do presentations during the school day, and then we would meet every Friday after school. And it was relatively low cost to do, and that group was really a safe haven for a lot of students who were not joiners and other kinds of extracurriculars. So that's one of the nice things about having a range of options for those protective factors, the more the better, so that there can be a haven, particularly for the most vulnerable students.
Thanks, Jenny. So the next strategy is to attend school events. So this includes things like parent-teacher nights, fundraiser, open houses, school board meetings, athletic events, other extracurricular events at your school that aren't named here. So set up a table and provide information, answer questions, and assist in filling out enrollment forms with family members. Translate the forms into languages spoken by parents or have an interpreter available. And make sure the forms are gender inclusive. Consider a handout with information about what types of services students can access confidentially. And when you introduce yourself, make sure to share your pronouns to normalize this practice. And then does your school have a GSA or a QSA? We've talked a little bit about a GSA, but just to be totally clear, a GSA can go by many names, including a gay straight alliance, a queer straight alliance, a gender sexualities alliance, rainbow club, diversity club, or something else. And to promote their events through your SBHC, either through your bulletin board, your website, or your social media. Alternatively, you could participate in a national social media campaign like GLSEN's Ally Week, where students and educators lead a conversation on what they need from their allies in school. You could offer to partner with student groups to participate as a way to both connect with those student groups and to gain visibility. So coordinating SBHC enrollment with other school enrollments, by thinking creatively about when and how you can coordinate your enrollment, you're going to maximize the number of types of students who are enrolled in your SBHC. If you're able to ensure students are enrolled, then when they need you and realize that you're in a trusted ally, they will have one less barrier to accessing services. And this is one of those recommendations, again, that you've probably all thought about or are doing, but just to kind of re-emphasize the importance of doing this, especially for this population. You know, some strategies just to be complete are, you know, putting the consent form with school registration. The front desk is often the most centrally located for all students and for their parents. So placing extra consent forms at the front office and educating the front desk staff on how to help parents complete the form. You could establish relationships with your athletic director and coaches to ensure they're recommending the SBHC for sports physicals over any, and then of course, using that opportunity then to do a well visit when you've actually got somebody coming for a sports physical. So those are the main 4 strategies that we're going to cover related to participating in school events and initiatives. Are there any additional ideas related to this that you all are thinking about or have tried?
We do attend the parent-teacher nights. We go to the open houses of all of our schools and attend the school board meetings. We haven't done any of the extracurricular events. We do all of our registration packets and consent forms do go home at the beginning of the year with all of the other forms that the parents have to fill out, and then they trickle back in through the school nurse, and the school nurse gets them to us. But I like the idea that you said about leaving it at the front desk of the school, and so we can incorporate that this year. One of the problems that we have whenever we go to the school board meetings, they want to know about our clinic, but they don't want to know, we're not allowed to talk about anything about STDs or pregnancies or, you know, any of the LGBTQ, you know, anything like that, because they said that it makes the surrounding area, or they don't want their area to look bad, you know, so we're not allowed to talk about, you know, things like that. So we can talk about any other service that we provide in the SBC, but we have to leave all of that stuff out.
That is a large challenge as far as the environment that you're working in, for sure. I think the point you made about the school nurse is a good another point to think about. Working with your school nurse to also train that person up on the enrollment forms and maybe leaving enrollment forms with them to be able to distribute as well.
Right. And another thing that we do with we work really closely with our school nurses, and we always let them know that we are their school-based clinic, and we try to keep enforcing that. So whenever a child does get sick or anything happens, the first thing that they think of is the school-based clinic, and we always, stress that we are your school-based clinic, because we want them to come to us first versus going outside.
Right. Thank you for sharing that. Great. Thanks.
Here at our school in Chicago, we do a big community partner meeting where we get together with other partners in the building. Like there's groups such as Becoming a Man, and we have social workers, and we all share various things that are going on with their clinic or with the programs, and we make referrals between community partners. So that's a really good way to kind of keep the ear to the ground, what's going on in the school.
Yes, that is a great point. It was a little bit hard to hear you. I think there was some kind of background noise or a funny thing with the connection, but I think you were saying that you have partnered with community partners to increase enrollment, and that's been a nice way to understand what's going on at the school and the community. Is that right?
Yes, sorry, we're having a little technical difficulty.
Oh, now you're much clearer.
Oh, okay. Yeah, so monthly we meet with the other partners that are in the building. Some of them, we have a program called SGA. We also have a program called Becoming a Man, and several others. And we also, a couple school staff usually attend the meeting as well. And it's just a really good way to share resources and know what's going on in the school. And then the partners know about what's going on in the clinic as well.
That's great. Thank you so much for sharing. So the next category is providing active teacher and staff support, which it sounds like we were starting to brainstorm some of those ideas as well. So hopefully we'll come up with some more as we move through these points. So providing an annual teacher and staff orientation to your clinic. Here's another example of a good practice for increasing awareness of your SBHC and its services for all students. So give staff and administration a tour through the health center and inform them of the services offered, and make sure to include information about behavioral health services and referrals to other services. Point out the SBHC benefits to the well-being of the student population, and talk about the influence your SBHC can have on minimized learning disruptions, absenteeism, and improving academic achievement. Remember and acknowledge that it can be frustrating for teachers to see students frequently called from class to go to the SBHC. Be mindful of this and try to alternate which classes you pull students from. Ask staff members about their preferred method of communication, whether it be email, phone calls, or face-to-face, text messaging maybe. Keep track of their preferences and use the method that is the most convenient for them. And if you're doing a presentation style orientation with teachers and staff, consider sharing some of those statistics that we talked about in the beginning around the discrimination and bullying of LGBTQ+ youth, and remind them that your SBHC is a safe place for them to come and get support. Offer professional development opportunities to teachers and staff. So offering educational opportunities to teachers and staff is a great way to not only build your relationship with the school, but also provide needed information about things like what services teachers can refer students for and what it means to be an askable adult. So these two images here are for our Sparks that you can download from our website. Craig last time combined 4 of our Sparks around providing LGBTQ affirming services in your SBHC. So this is the same idea. These would be a good fit for other teachers and staff in your school. So the first one on school referrals is about thinking through the role school teachers and staff can play in your health center, and specifically gets into some information about what the minor consent and confidentiality laws are in your state, so that teachers understand what they can and cannot refer students for. We've heard from teachers and staff that they're kind of sometimes wary of making those referrals or telling young people to get certain types of services when a young person or a student discloses something to them because they're not sure if they're supposed to or they're allowed to. So this Spark unpacks all of that. This one is a state-specific Spark, and so it has to be customized for your state. So currently we have one for the state of Michigan and the state of Illinois, but if this is something you would be interested in, you know, email me after this and we can talk about how we might be able to make it for your state. The other one is about being an askable adult. So this Spark discusses the strategies that adults in the school can use to make young people feel comfortable and supported in disclosing things to them. So again, this Spark would be great for teachers. In fact, the scenarios in the Spark take place in a school and as it follows a young person throughout their day and what their experience is talking to adults at their school. So these are two things that you could easily download, use the script, and use. It does take at least 15 minutes to do, so I know that can sound like not a lot of time for me to say, hey, if you just take 15 minutes and go do this at a staff meeting, but I realize that even getting 15 minutes on an agenda can be incredibly challenging. So if you are able to get those 15 minutes, this could be a nice way to offer some training and also facilitate a connection. Another opportunity would be that GLSEN has an amazing array of trainings and resources on their website on topics such as pronouns and LGBTQ+ history. This training is this is a screenshot from one of their trainings, Allyship in Action, and it's a great option for shared learning among all members of your school community. Just like our Sparks, this toolkit provides everything you would need, including the talking points to lead the training. You could partner with school administrators to train teachers and staff on the intersection of HIPAA, FERPA, and your state minor consent and confidentiality laws. You could make a training or a short handout to make sure that everybody is on the same page about those things. Have a presence at school meetings and events. Attending regularly scheduled staff, department, or committee meetings can show how much you care about the students and are invested in the school as a whole. It also is an opportunity to remind people that you're present in the school. The more you show up to these meetings, the more you'll be able to advocate for inclusive policies and procedures. Later on, we will cover some sample school policies or some strategies that have worked before to show you some of the things that you could do. And it sounds like some of you have shared that you have done some of these things, that you are actively showing up at those meetings. So you that's great, and you might have some other strategies to share as well.
There are a few comments in the chat box, so I just wanted to let you know, Ellen. Sure.
Thank you. Yes, the chat box is showing up kind of behind my PowerPoint on my screen, so I am periodically checking back to look at it, but I, for some reason, can't see it in real time, so thank you. So let me catch myself up here. I see Brenda from a little bit ago was talking about, yes, that your SBHC collaborates with the registrar. So this was when we were talking about enrolling students in the SBHC. This is really neat. So the registrar invites them and at times will even escort people to the SBHC to enroll if they wish to. And then Amanda shared that for our staff orientation, we do a staff breakfast when they can come back from summer break. It's a little more informal, but since we provide food, food is always important. If you're able to provide food, people will show up more often, I think. So that's a great strategy. And it is a nice opportunity to give your people a tour of your SBHC. So yes, if you can add food into your orientation, into any of these meetings, that is also a great strategy. Thank you. Okay. The next one is to build relationships with teachers and staff, which goes along with some of these things we've been talking about. So be mindful of your entire school community when you're thinking about building relationships. So for instance, if you are leading a training at a school, consider the wide variety of staff members that could be participating. So even beyond teachers and staff, are there custodial staff and security that could participate and benefit from the training? Every adult that interacts with a young person should get the opportunity to engage in this conversation. For the sake of completeness, I wanted to mention asking for feedback is always a good practice. Create opportunities for teachers and staff to provide feedback to your SBHC by filling out end of the year surveys. Be sure to include questions about what would be most helpful to them, including further training opportunities. Any other ideas around ways to provide active teacher and staff support? I'm scrolling back to the chat box, so if you've got an idea and want to chat it in, I am looking.
Ellen, I just wanted to mention that I don't know if this is the case for the school-based health centers that are participating on this ECHO, but I know that a number of school-based health centers nationally, they also will provide services to teachers and staff as well. So that's another great way of bringing the staff in, is to let them know that you can come here if you have some kind of acute thing that needs to be addressed, you know, that day, or they can go get their, you know, their exams there or whatever. So that's another great way too of letting staff know that you're there, that they themselves can sometimes get services there.
Thank you for saying that. Yes, that is a very good point and thing to consider. And also in the way that we're thinking about supporting our LGBTQ plus teachers and staff in schools as well.
One thing I want to add for being present at things, we always make sure we're at things like the prom and graduation, and we don't just attend, but like I help on the decorating committee of the prom, and we walk with the teachers and graduation and things like that. So it helps us kind of just be ingrained in the culture with the staff. So they call us if they're having a staff potluck and say, hey, the health center is part of the team, you know, too. And so we kind of build those relationships and things that aren't necessarily in our scope altogether. Yep.
Yes, really doing everything. You're really a team player, doing everything you can to feel immersed in the school. Thank you.
I kind of want to caution having all the teachers come down to the health center, because then, you know, typically what somebody will say is, well, what are you here for? And so then there's this you know, I don't want to come down there if it's going to be, you know, too many principals around and whatnot. So I tend to not, you know, if it's an emergency, of course, but not routine care.
Thanks for sharing that. Also an important consideration. Okay. So the next category, establish and maintain close relationships with school administrators. So learning about the school's goals and priorities for the year, take the opportunity to identify ways in which the SBHC can support the school and academic achievements of students. So this is a kind of along the lines of what Amanda was just sharing. Discuss potential collaborative funding opportunities that may be available for the school and the SBHC. Sharing outcomes data with school administrators to highlight the successes and review the needs and concerns, both for the SBHC and administration, to identify opportunities to collaborate on priorities for improvement efforts. Consider sharing de-identified patient stories for times when you've had a particular impact on student health and lives. This could be on any student, an LGBTQ plus student, a student who's having a hard time attending school, or a student with uncontrolled asthma, for example. And these success stories can really stick with people and impact their perspective on your role in the school. I think this can be really impactful, and it is, if you are going to do this, to be so important to really, truly make sure it's a de-identified story, or a story where you've changed it enough that no way you could know who the student was. But those types of success stories are things that bring alive the data that you could also be sharing. So that is kind of my main strategy. There was kind of a lot packed in there around just kind of having a continued dialogue with school administration and finding where there's kind of alignment in goals and priorities. Any other ideas? I know we've already talked about a few of these through the course of the conversation, but anything else we've not covered yet?
Well, this is Takesha with Saginaw High School School-Based Health Center, Great Lakes Bay. We actually, our school, we have a walkie-talkie, so the school can communicate with us if they have any concerns. So if they have emergencies or anything of that nature, they will call us. They'll say like health center to whatever location the student is at that time, and we respond. I'm not sure if that's customary for all schools, but it is very helpful in the event of an emergency or going on in the school where we need to respond.
Thanks.
Welcome.
Just check the chat box one more time. Okay. So the final category that we're going to cover is having youth ambassadors to foster connections. And this is perhaps the most important area you can focus on. The youth that are a part of these communities are going to have the most insightful ideas on how to strengthen your connection and connect youth to your services. So AHI has a manual you can download from our website on establishing and maintaining a thriving youth advisory council. And this manual was developed through collaboration with youth across the state, including from some school-based health centers that are participating with us right now, I believe. And this has practical and actionable advice about how you can establish and maintain your YAC. When you're recruiting members from your YAC, think about where and how you're advertising to increase diverse representation. So think about when your YAC meets, is this a time that overlaps with other activities? For example, if you wanted to make sure that students who were also members of the school GSA could participate, then try to coordinate meeting times so that they don't overlap or that they're convenient for students to be able to participate in both. The School-Based Health Alliance has an entire page on their website about establishing and maintaining a youth advisory council with lots of helpful tips and tricks and links. So be sure to check that out. I also, when I was looking around on this page, was reminded that AHI and School-Based Health Alliance actually have a youth council member in common, which is pretty neat. So I just thought that was fun. It was fun to see that person's information on your website and know that they're also sharing ideas nationally. So create opportunities for your YAC to present at school. So your YAC can present health education in classrooms, assemblies, and lunch events. That allyship training that I mentioned earlier could be led by your YAC for other students as well as teachers and staff. Many of the trainings that GLSEN offers are for students and could be led by your YAC. So consider having your YAC partner with your GSA to lead any of these trainings as well if there's a GSA at your school. Or in the case of those schools that don't have a GSA, like I think some of you mentioned, your YAC could do these things. So work with your YAC to make more affirming physical space. So again, this could be in partnership with your YAC and the school GSA, or if your school doesn't have a GSA, your YAC could take the lead on this. But work with your YAC to identify ways that you can make the physical space of the school more affirming. So here are a couple examples that we've seen. This one, I think maybe both of these examples, or Jenny, do you want to chime in? I think they also might be good examples from people that are called in right now.
The one on the left, it looks like Amanda might have stepped away for a minute. You were involved in the pink one, right? Yes.
She's muted.
I saw you say yes, but you were muted.
Yes.
So what I really like about these two photos next to each other is that I think the one on the right hand side is actually a stock photo. I'm not even sure, maybe it's from I take pictures as I go around to different health centers and my kids' schools. But the one on the right is obviously a more explicit kind of message that this is a safe space, and we've got the rainbow triangle, which is sort of a visual cue for young people who identify as LGBTQ+. Will I hopefully, you know, recognize and have comfort with. I'll just share that anecdotally, when we've worked with young people who talk like specifically about being LGBTQ in schools and about what makes them feel comfortable, I think of numerous times that young people have said, seeing that sticker on the nurse's door or having that lanyard on the social worker that was a rainbow lanyard, or just a small pin can really go a long way. The point I want to mention about the image on the left is how fabulous it is at just feeling like it's an inclusive space, while not, you know, it can range anywhere from having rainbows specifically to just saying everyone is welcome here, all of your original voices are welcome and celebrated here. So there are more implicit ways of being affirming to all and more explicit ways.
Thanks. Work with your YAC to create a PSA campaign. So foster your YAC members' creativity by encouraging them to create a PSA campaign. That could be posters, screensavers on library computers, announcement relative to the health needs of your school. And this could be including information about the services offered at the SBHC and what you can access confidentially. And then the final strategy that we're going to talk about is having your YAC present to school administration. And I am going to let Jenny talk more about this. I mentioned earlier some practical strategies or what some of that can look like that Jenny's going to get into more detail here for you about.
Thanks, Ellen. I think I'm going to scooch the camera for a sec. So
Sure.
There. Okay. So I wanted to share just a couple of processes that have happened both in Ann Arbor, which is where I'm a parent and also a resident, and I'm the co-chair of the Ann Arbor Public Schools Sex Ed Advisory Board. And so in Michigan, in the state of Michigan, school districts that teach sex ed beyond abstinence and HIV are required to have sex ed advisory boards. And so in that role, I was able to partner both with the school district and local community folks, including school nurses and SBHC staff, to bring about really wonderful change in policy, specifically around policy for transgender students. So that was at the school level, at the school district level. And then also about 2 years ago, the picture that you see on the screen, you might even Mo Connolly is there on the left, and she is a provider who works with Henry Ford and Ruth Ellis Center, which I noticed that one of the cases is with Ruth Ellis. And then these youth I brought up to Lansing with me to help to provide an opportunity for them to give voice to youth perspectives and priorities on state advocacy efforts towards state policy, and in this case, recommendations. So basically what happened was through a lot of collaborating with key people, but SBHC folks had key roles in this, we advocated with the State Board of Education to create recommendations for safe and supportive learning environments for LGBTQ youth in all schools in Michigan. So again, these are recommendations that they came out with and not policies, so they're not required, there's no teeth. But what they allowed districts to do is to point to the recommendations, and the recommendations were really soundly supported by evidence, to be able to say, these are the recommendations, we're going to implement the policies. And it was interesting being in Lansing there, hearing from strategists and people who were advocacy experts who were saying, the state's not going to adopt a whole policy, but they will come out with recommendations. So that squeaked by, but it was a huge celebration. And then after that, Ann Arbor Public Schools adopted a policy focusing on transgender students, as I mentioned, but the state one is LGBTQ. So for anyone under the umbrella of LGBTQ plus students. So the cool thing that I will just say about working with the district to pass the Ann Arbor one is that it's really expansive. There's so many parts on it that are just very concrete and clear about the responsibility of the school and the school personnel to put the students' identity and needs first. So specifically thinking about transgender youth. So there are a lot of different categories on there. It was modeled after, GLSEN has a model policy. Ann Arbor Schools policy was modeled after that and then strengthened. Philadelphia also has a similar kind of really ahead of the curve kind of policy. So I just wanted to share that because it has been a really nice way for teachers, administrators, and anyone within a school who's caring for LGBTQ youth to have some support when they say that they want to use that student's correct pronouns the student has identified, that they're using the name that the student wants to use, that dress codes are respectfully and not gender-based, in terms of their enforcement. And there are some really, the other last piece I will mention that I think is really interesting about these and what makes these policies seem really progressive is that the policy around locker rooms and communal changing areas is that that transgender students should use the locker room that aligns with their gender identity. If there are any students who are uncomfortable with it, the district is required to make accommodations for them, but the district should not be singling out the transgender student. So you follow me? Basically that they're saying the transgender student can be in the changing room with everyone. If someone's uncomfortable, they're the ones who would need to use a different area, a smaller area or something, so to not further stigmatize the transgender student. So if you're interested in any of the policies or model policies around that, follow up with us and we can share those with you. And again, GLSEN we've been citing, which is the Gay, Lesbian, Straight Education Network, GLSEN, they have a lot of these templates and resources. So I would be happy to talk to anybody too who's advocating within their district to change and adopt new policy.
Thank you. So those are all of the strategies we're going to share about having youth ambassadors to foster connections. Any additional ideas related to this? Okay, so that is the end of the recommendations. Now that we have reviewed all that, what are some new things I'd be interested to hear from you all that you could try to make your school a more welcoming and affirming place? Was there anything that stuck out to you or that sparked an idea about something you may be able to do going forward?
I think I'd like to do a staff in service. I think that would be helpful. I think
Great.
the stats you provided were some pretty good ones.
Great. What about new things to try related to connecting young people to your school-based health center? Well, if you think of anything else, you feel free to chat in or chime in at any point. And then either think to yourself, or if you feel like sharing, what do you foresee as some challenges to either making your school a more welcoming and affirming place or connecting young people to your SBHC? So take a minute and either think that through for yourself, and if you feel like sharing, great. And what can you put into place to help you succeed? So knowing that thinking about some of the things that you've learned, what might be some of the challenges to doing those things, then taking a minute to think about how you're gonna set yourself up for success. Okay, looks like there's a couple ideas shared over here in the chat. As a school-linked health center, I want to go to all the school-based health centers in my area and talk with them about services that aren't available in school, like PrEP, hormone replacement, and contraception. That is great. Yes, because in some places those things are not available in schools, and so that is so important to share with the schools so that they know that they can refer. And some new things that we've tried include summer barbecue to get kids in for physicals, again with the food. Excellent idea. Youth school robocall system, and have a share closet where kids can access clothing and toiletries. Those are all great ideas. I like that. I like the idea of using the robocall system. That is also a sort of sad name for the automated call system, isn't it? Robocall. Great, thank you. So that is it for today. Thank you all so much for participating and sharing your ideas. As Suzanne shared, this will be available on the Moodle website. The slides will be available. And as Jenny said, our contact information is on the first slide. Please feel free to email either of us with questions, or if you heard us say something or want help getting pointed towards some of the resources we mentioned, please let us know. Thank you.
Thank you, Ellen and Jenny. All right, I'm gonna
stop sharing.